On the topic of the individual mandate for the uninsured, my first question that I'm addressing in my presentation is if that is a fair policy. In the Affordable Care Act, there was a Supreme Court case held about the individual mandate part, which ended up determining that it was constitutional for the government to use the tax penalty. However, in the Obama administration's brief defending that part of the law, they said, and I quote, as a class, the uninsured consume $116 billion of healthcare services in 2000. So, what are your thoughts on that?
Well, my thoughts is I agree that the underinsured most likely did consume that much, only because I know firsthand many individuals that were without insurance. And so the emergency room actually became their go to for any type of medical illnesses. It could be something as simple as a cold.
And why is that not necessarily the best for our economy to have uninsured going to emergency room?
Well, first of all, because the costs are astronomical in emergency rooms for a cold, a common cold, that's something that you could purchase cough medicine for about $10 for, whereas going to the emergency room, they would have to see the physician. There's times that the nurses come, they take all the vitals, so that's a cost. And then only to say, well, you have a cold, you can take NyQuil or you can do whatever and be discharged. So then there's the cost of then having the nurse come back in to say you can be discharged. And then they give you the discharge papers. And when all is said and done, it's $150, whereas it could have been something as simple as $10, or it could have been something as simple as $40 going to a physician in their office just to be told that you have a common cold.
So, we had talked a bit about the Supreme Court case that addressed that, but there was also a poll made by the Kaiser Foundation that found when most Americans were told that they would automatically satisfy the requirement anyways because they already had employer covered healthcare,
Mm-hmm.
and the favorability towards the mandate and people's acceptance of that as part of the Affordable Care Act overall nearly doubled to almost 61%. So, what were your thoughts on how most Americans would end up being covered by their employers anyways, and how that affects the individual mandate? Like, is it more fair because that's the case, because so many people would be covered by their employer health care?
Right. I feel that so long as the government offers a subsidy for those who can barely afford insurance, then I believe the tax mandate is fair. I do believe everyone should have access to health insurance, and those that can afford to pay for it should pay for it. Again, most are covered under their employers, and I have mixed feelings about it from the employer's perspective because the small businesses then um, take quite a hit because the cost of insurance is astronomical and it is a broken system. It sort of eats away at the profits for the small businesses.
So I'm going to move on then to actually you kind of mentioned it a bit earlier how there are also subsidies given to people who are less fortunate and can't afford the healthcare programs. So the next question is if that's a fair policy economics wise, tax wise. Well, the subsidies are based on income, and anyone making less than 400% of the federal poverty level can get some type of subsidy on a marketplace plan. Do you think that that number like that level for you to qualify for a subsidy is too high or maybe too low?
I think that number is too low. I believe there are quite a few people in what we call the working poor class that should be eligible for subsidy, but they are not. And I think their number is too low because those that need it are sort of left out, um, that could use the help. Those that qualify for it get all the help that they need, but those that are trying to really make a living are left out. And so I think the number's too low.
Can I ask you to kind of summarize how the changes brought about through the Affordable Care Act might have affected the way you do your job?
Well, the Affordable Care Act actually is very time consuming because you have to pay attention now to all the hours that a person works, especially if you have part time people. Because if they work at least an average of 30 hours, you have to offer them health insurance. And if they fall below the 30 hours, then you have to stop the health insurance. So it's time consuming in monitoring how much did they work, did they fall below, how much are they working now, do you have to offer it again? And then there's the look back period that you have to look back over the last 12 months, and then you have to look forward. So it is very time consuming in managing it. One of the things the Affordable Care Act has done is, for us, I should say in our company, is push the employees to be better consumers for their health care. I mean that by saying we were able then to offer 5 different plans. So the employee has more choices in what they want for health care. And if they choose a high deductible plan, then they're more likely to research what needs to be done according to their health, how they're going to pay for it, and then who provides the best services for their dollar.
So we have this part of the decision that the Supreme Court made over the individual mandate actually addressed the expansion of Medicaid, which was another part of the Affordable Care Act. So Pennsylvania, along with many other states, kind of grappled with that question: should we expand it? Should we not expand it? I was wondering how the decision that the state decided to go with in terms of expanding Medicaid, how did that maybe also affect part of your job or part of healthcare that you've experienced in general?
It really has not affected us too much. We do have employees who are working that are eligible for Medicare, but they still elect to stay on our plan. I think part of it is the fear that once they come off our plan, Medicaid won't give them the coverage that they need. But with the expansion of it, I think that it will give them the coverage. It's just a matter of being educated to what it really has to offer.
How familiar are you with the current like top 4 political candidates, let's say before Ted Cruz dropped out, with their healthcare reform ideas?
I was pretty much informed about where Hillary Clinton stands, only because I know back in the Clinton administration, she was one of the forerunners that wanted to reform the health care. I'm not too familiar with Trump's because I'm just not a Trump fan and I don't want to listen to what he has to say. As far as the other candidates go, I haven't heard them speak out too much about that issue.
So one of Trump's proposed policies is that he thinks that there shouldn't be such state-by-state kind of policies within our healthcare system, and he thinks that Americans should be able to purchase health insurance across state lines, which is also a policy that Ted Cruz supports. What are your thoughts on that?
Yeah, don't I don't agree with purchasing healthcare across state lines. And I say that only because there are some states that are poorer than other states, and you probably would have the people who needed to purchase health insurance purchasing it in the states where it's a more poor state, and most likely the health care there would be cheaper. And so then you would end up taking from those in that state who really needed it, because the after a certain amount of time, the underwriting is going to go up for those in that state because of all the claims that will be on the insurer of that state.
Bernie Sanders, he did support the Affordable Care Act, but he believes it didn't go far enough because he is shooting for a single payer system, meaning that the federal and state governments would provide healthcare to everyone. The biggest concern that most people have when on this topic is that it would, even his own administration admitted that it would have an estimated cost of $13.8 trillion over the next 10 years to achieve that. However, many others would argue that that's the right goal to be shooting for. What are your thoughts on like a single payer system?
I'm not a fan either of a single payer system. Um, First of all, because it's going to affect our future generations. I mean, the 13.8 trillion is now. That's not to say what it's going to cost in the future. I think what we need to do now is stop trying to mandate people to pay for the health insurance and start reforming the insurers and the um, pharmaceutical companies. That's what we need to start doing, because it's a broken system.
So, are you talking about the individual mandate, the penalty for the people that are uninsured? And you think that that's not where we should be focusing our efforts? We should focus our efforts at the insurance company level.
Right. Yes, I believe we should focus it at the insurance company level and with the pharmaceutical companies. So let me give you an example. They have a new cure now for hepatitis, and it's a pill that you take for 90 days, but the cost of that is $30,000 a month. There are so many people who could benefit from that, but to make a pill, the cost of medicine, $30,000 a month is ridiculous.
How is the cost of that covered within either within your own insurance covered by your company or within the federal insurance?
Well, that for our company, that cost, it depends. If an employee had a high deductible, they would be responsible for their first deductible cost, which we have plans like 2,000, 4,000. So if they had a family plan of 4,000, $4,000 of that $10,000 would the employee would have to pay for first, and then the 10,000 the insurance company would need to pay for. However, the insurance company would have the right to say, we don't cover that treatment, therefore we're not going to pay it.
And do you know about maybe at the federally funded marketplace insurance rather than the ones that your company offers?
Right. The federally funded insurance companies are also the same private companies. So most likely they would have the same reply that we don't cover that treatment. Now, I'm sure if the treatment starts reducing within the next 10 years, they might cover it. But for now, they're not.
And so you think that efforts should be spent to control prices on pharmaceuticals, but also control the policies of these private insurance companies?
Right. Yes.
And you would support perhaps like federal policy that addresses that?
Yes.
One last question. The last kind of main point of my presentation is going to be on like the overall benefits and drawbacks that we've experienced as a country with our healthcare system since the onset of the Affordable Care Act. And I have like a whole bunch of statistics that address the uninsured, the underinsured, the gap of people in different states where Medicaid wasn't expanded, who now just don't have any coverage at all. But what would you say, in your experience, has been some of the greatest benefits and some of the greatest drawbacks to the Affordable Care Act?
I would say one of the greatest benefits is that there are people who at one time were not eligible for insurance who are now eligible for insurance for whatever medical reasons, whether they hit the insurer's cap or whether they had a medical disease where it just wasn't covered, and so, or was pre-existing, and so underwriting declined coverage for them. I think the benefit is that those people have insurance no matter what. They're able to get it. One of the drawbacks that I see is that there still are some people who refuse the company's insurance. There's still that mentality there. They refuse the company's insurance, but they don't have the education or the knowledge to go out to the market exchange, or once they're out there, they don't understand insurance enough to select what they need. And so they just choose to go without because they think that it's easier to pay the penalty than to deal with the whole insurance situation.
Why does the mentality exist that they don't take the company's health insurance?
The mentality had always been that if they were low income, they had their own insurance, or if they could afford the insurance, they had the choice to say, no, I don't want to choose it. I don't go to the doctor. I'll pay if I ever need. So they still have that mentality that I'll just pay if I ever need it.
Could you just explain for the viewers and for the audience of my presentation, like what it is that you do and how it relates to healthcare?
I am in human resources, and so this relates to me as far as benefits go, because what we want to do is be able to offer benefits to our employees and their families, but at a reasonable cost. Fortunately for us, we have been able to contain our costs. I hear others where the costs have just skyrocketed. Each year, renewals are like 53% more, whereas we have been able to contain ours where our renewals have been maybe 1 to 2% more. And I think that has been because we have been able to offer the different plans under the Act, and we have given employees the choice to use the plan that works best for them. And because the plan works best for them, it has cut down our experience rating and cut down our underwriting.
Okay, well, thank you very much. That's all of the questions that I have for you.
Okay.
So thank you so much for doing this interview with me.
Thank you.